universal vaccination for hepatitis. We have a hepatitis B vaccine. Unfortunately, there's no hepatitis C vaccine yet, but this is a very important worldwide cause of cancer. H. pylori is a infection that is commonly found in the stomachs of apparently healthy people. There was a study published a number of years ago from Italy and blood donors, and they were screened for H. pylori, and about a third of them had H. pylori infection with no symptoms. They were then studied more intensively, the patients who had the H. pylori, and a few early gastric cancers were discovered on endoscopy that were still curable.
Right. Now it's a certain kind of gastric. Is that the one that is like a lymphoma type?
Oh, you're talking about malt lymphomas.
Right.
Yeah, this is a low-grade lymphoma, but actually I'm talking about epithelial gastric cancer, right. There are low-grade lymphomas also associated, and actually treatment of the infection can sometimes make the lymphoma go away. But these are low-grade lymphomas that aren't, in the first place, they're unusual, and they...
I just remember it because it's always a board question.
Yeah, and then in Egypt, famously, there's schistosomiasis, which is an infection that gets into the bladder. Yeah, in fact, when Napoleon invaded Egypt, he called it the land of menstruating men because everyone was urinating blood, and that's associated with bladder cancer. So preventing schistosomiasis is a way to prevent bladder cancer, at least in that part of the world. It's obviously it doesn't occur in the United, or it's very, very rare in the United States. But infections are very important. The radiation. We think of radiation, and most of the studies relating to cancer and radiation come from observations of what happened to people after the atomic bomb in World War II. But we need to think about radiation in terms of medical radiation. People get CAT scans, X-rays in this country left and right. I have patients always asking for CAT scans, and I have some kind of back pain or shoulder problem, etc., abdominal pain, and the first thing that someone thinks of is, let's get a CAT scan. And the amount of radiation involved in CAT scans is tremendous. So it's been calculated that every CAT scan of the body gives you enough radiation to increase your cancer risk by 1 in 4 to 500. And that's cumulative. So every time you get a scan, it's now 2 and then 3 and then 4. So it's additive.
Right.
So it doesn't take you long to get a lot of radiation exposure. And I think it's something that people really have to think about. I think the physicians have to think about it before they order CAT scans and various imaging studies. And patients really have to think about do I really need this test because I'm getting all of this
It's interesting
exposure.
Because I think patients think that way about X-rays, but they don't make that leap for CAT scans. You'll have a patient who'll say, well, do you really think I need a chest X-ray because of the radiation? But that same patient will say, I think maybe I need to get a CAT scan.
Yeah, but the CAT scan has a lot more radiation involved with it than
but not MRIs.
X-ray.
MRIs don't
MRI, so far as we know, MRI doesn't have the radiation problem because it's obviously a different imaging technique. And the American College of Radiology has actually put out the suggestion that initial testing be done with a CAT scan, because CAT scans are useful and they give you different information than an MRI, but then once you have identified the problem, that you follow it up with an MRI. One of the other problems is that it's easier as a doctor to get a CAT scan because it's a lot cheaper than an MRI. So the insurance companies are working against you in that they want you to get the CAT scan and not the MRI because it's much cheaper for them.
It's true. The insurance companies, that's a whole nother show, but they...
Yeah, we're having this problem. So, but I think it's something that you really have to think about. In terms of preventing, just in general, in terms of preventing cancer, people focus on vitamins and supplements, etc. And actually, there's precious little information saying that any particular vitamin or herbal supplement is helpful in terms of prevention. In fact, it can work just the opposite. Now, it makes sense in many ways to think about vitamin supplements or herbal supplements. As you get older, your intestinal tract doesn't work as well. So it's estimated that people over the age of 60, about almost a third of them, when they're analyzed very carefully, will have some deficiency of or microvitamin deficiency. In other words, a deficiency that if you test for it is there, but they won't be symptomatic, so it'll be subclinical. So it makes sense for people as they get older to take some kind of supplement. And also in population studies, we know that people who have low levels of certain vitamins are much more prone to particular disease or particularly cancer. For example, people with low beta-carotene levels were noticed to have significantly higher risks of developing lung cancer, particularly if they smoked. So the thinking was, well, let's give these people beta-carotene and we will eliminate or reduce the risk of them getting cancer. And that was done. And very, very good randomized, controlled studies with large numbers of people both in the United States and other parts of the world. And the result was actually just the opposite of what everyone wanted. The people who were supplemented actually got more cancer than the people who weren't supplemented. So even though it might seem logical to think that, low beta-carotene, more cancer, so let's give beta-carotene and we'll get less cancer, it actually didn't work out that way. And this has now been substantiated in several other cancers, and prostate cancer as well, et cetera. So just willy-nilly taking high levels of any particular supplement may actually aggravate whatever problems you have rather than cure them. So it's in general, not too much and not too little. You need just the right amount of everything.
Right. What do you think about vitamin D and its association with colon cancer and breast cancer?
Well, it's the same thing. Low levels of vitamin D associated with higher risk of colon cancer and breast cancer, but it has not been shown that supplementing vitamin D affects the incidence of those cancers in any way, and it may turn out just the opposite of what you want. The one supplement that has been shown to be helpful is calcium. Right. It reduces the risk of colon cancer by about 20%. So
is there a dose that people need to strive to take?
Well, I normally recommend about 1,500 to 2,000 milligrams a day of calcium. That seems to be the right dose. And it's also, obviously, calcium is important for your bony structure. As you get older, you tend to develop osteoporosis. Not just in women, this is also a problem in men, particularly men who are getting treatment for prostate cancer. They tend to develop osteoporosis as well. And strong bones are important. One of the interesting things about cancer treatment is that one of the drugs, or several of the drugs that we use to make the bones stronger to prevent fractures from cancer that has spread to the bones, turns out that these drugs actually also prevent cancer from even getting started in the bones. So this has been true for Zometa for breast cancer, for example. So it's actually helpful not just to prevent the problems or the complications of metastatic breast cancer, but it actually is helpful in preventing a new breast cancer or a breast cancer from recurring and going into the bones. It's been very, very helpful in that. So this is an example of active treatment after the fact or secondary
Right.
prevention.
Now, I had a question in reference to it. It may seem intuitive that a healthy lifestyle would basically decrease your risk, but how is that? Because, you have patients will always come back with the story of, well, I had a friend who was the poster child for healthy living and ended up getting a blah, blah cancer. So how is it that, let's start with obesity, how is it that being obese increases your risk of cancer? I've read different things, it's the estrogen that gets stored.
Well, for breast cancer, in particular, obesity is a risk factor, but it's also a risk factor for other cancers. Looking at it another way, there are now a significant number of people who've undergone bariatric surgery or surgery for weight reduction. And those people have been followed now for a number of years because this surgery has been used for at least 10 years now.
Right.
And there was a publication not long ago in that followed people who had bariatric surgery for over 7 years, and they had about a halving or 50% less risk of cancer after the bariatric surgery. So to me,
so that's a lot.
Right, and it's not just breast cancer, it was other cancers, colon cancer as well, uterine cancer, lung cancer. So if you take an obese person and you restore them to a relatively normal weight, you substantially reduce their risk of developing or a variety of cancers, in addition to all the other benefits of having a normal weight. So obesity is clearly a risk factor.
Right. Well, I just wanted to thank you because this part of the show is over. Half an hour goes quickly. I hope this has been really informative, and part 2 will be next week. So thanks for joining us, and thank you. This is Dr. Joseph Bottino from the Strand Clinic and also Northern Westchester Hospital. And hope you tune in next week for more information.